What's up, guys? It's the Basketball Doctors. We're gonna go over Q&A today. We're answering some of the questions you guys asked us, and today the topic mostly is all ACL questions. So we're gonna try to answer as many questions as we can. We have a list of them. My name is Dr. Marco Lopez.
I'm Dr. Gabe Ignacio, doctors of physical therapy and co-founders of Basketball Doctors. Like Marco mentioned, mostly ACL post-surgery questions for this particular video.
Yeah, so let's just jump into it. So first question is by Shelby Brewer 8713. What should I be doing for my knee prior to surgery?
Yeah, great question. It's an important one. We're big on prehab, so pretty much rehab before surgery. We are just big on it because it sets you up for way more success and better outcomes post-surgery, and two, it kind of sets the standard of what to expect and give you kind of like ease of mind post-surgery. You get a lot of questions answered during that time frame. And you don't need to see a physical therapist a lot. You just need to see us maybe like once or twice before surgery just so that you can get going. But big things we try and get going as soon as possible is decreasing as much swelling as possible, get as much range of motion as possible, especially extension and flexion. Make sure your quad is firing well, gain as much strength as you can in your leg muscles, and pretty much normalize your walking pattern before you have surgery. Just all that stuff, and then learning what you need to do post-surgery. There's just a lot of education that happens during that time, so it's huge. We feel like it helps so much with our outcomes with clients that we have seen. That's my thought. Marco, anything to add to that?
Those are all great points. I think the big thing too is like it helps kind of build the interaction already before the surgery, so you already know what to do right after. Like, hey, right after the surgery, you're gonna start working on this, and it also just sets you up for great outcomes. Like Gabe said, I think they've done a lot of research studies where, you know, the stronger you are and the more mobility you have, the less swelling you have before any kind of surgery, the better the outcomes. Because I've seen sometimes when people had surgery 1 or 2 weeks after, they didn't do anything, their knee was still swollen up, and they had issues right after because their knee just didn't really recover. So working on before surgery is gonna just set you up for long-term success.
Next question is Karan Kulyar. After ACL sprain and surgery, how many weeks can we get back to running?
Oh, that's a good question. So we'll kind of answer it two separate ways. So I know he said ACL sprain / surgery and surgery. So with the ACL sprain, it's very different than the surgery. The sprain, you know, much quicker. You know, it depends on what grade the sprain is. You know, if it's grade 1, grade 2, how much instability. But a lot of the times you'll get back to running pretty fast, especially it's just straight line jogging after a sprain. Because the sprain, there's no surgery required. You know, most of the time with that instability, you probably won't even feel any instability running in a straight line, straight jogging. Especially if it was a grade 1, grade 2. It's just seeing, you know, how functional are you after. Because I've seen some people that sprain their ACL, it, you know, gives them some issues for 1 or 2 days and they'll be fine. But it's very dependent on the grade of that sprain. But I think the big one that he was trying to ask is more the after surgery. So when it comes to after surgery, this is very individual based. I know a lot of surgeons clear people at 3 months, but sometimes they're not ready at 3 months. But you want to make sure not only if you're cleared, but if you're functionally able to go back to running at those 3 months. Because sometimes some people are still working on range of motion at those 3 months and they don't have full strength. But at 3 months, we want to have that full range of motion. That's for sure. That's like a hard thing that we need to make sure that you have. We also have to have good strength by then. So meaning like you want to be around that 80% quad strength in your ACL leg that you just got reconstructed, because when you're running, it has a lot of quad focus, quad strength movements, eccentric control. So what happens is if you go back too early, and that doesn't mean you can't go running at 3 months, is you want to just set up for success. Because if you go to running too early, you might have that patellar tendinopathy, quad tendonitis, just because that quad isn't strong enough. And there's certain criteria we have to pass. So we can't really give you a timeline specifically, but wait at least 3 months. That's in my opinion. What do you think, Gabe?
Yeah, I think to answer the first part with the sprain, it's very much based on your strength and stability. Like Marco said, you're not waiting to protect surgery or the graft, so it's pretty much based on your capability of doing it. And that's usually maybe 4 to 6 weeks. And then regarding the reconstruction, Marco nailed it with, we're very criteria based. It's hard to give a time frame, but we do give time frames because that's when you're medically cleared to return to running. And most surgeons, if it's just an ACL tear, is usually around that 3 to 4 month mark, usually that 3 month mark. But with that being said, that means the graft is safe to tolerate the running movement. But from what we've seen, depending on how soon you work with us, we make sure you are physically capable of performing that running exercise, because if not, you're going to run into more issues and actually delay your rehab and prolong your rehab. Like what Marco mentioned, you get like the patellar tendinopathy, you get patellofemoral pain, shin splints even, like if you keep doing it without really talking to somebody. And that's what we end up seeing a lot of people post, post 4 or 5 months, they felt like they were clear to jog and they just started jogging on their own and they have a bunch of issues. So we really got to make sure you're able to physically complete those tasks, but medically cleared at 3 months.
Yeah, great points. Like I said, don't fall into the trap at 3 months. Everyone's different. Take your time, make sure you pass your criteria.
So yeah, the next question is from Austin Jones, 1675. Just to summarize his question here, so he had ACL, MCL, and a meniscus injury back in 2020. Ended up having ACL reconstruction, and he's about 7 to 8 months post-op. Went through all his PT. Hasn't played basketball yet, but wants to get back into it. And he was wondering what our thoughts and suggestions are for knee bracing. What are your thoughts, and what do you think about bracing post-ACL reconstruction as you return to higher level function?
Yeah, so the research right now it doesn't really support as much bracing per se. And a lot of surgeons that I spoke, they stopped giving out braces. Some do for contact sports, significant contact sports. But I think my biggest thing is maybe they haven't done full rehab yet, because I think from what I remember, what I see is 7 to 8 months. I usually would want to work with them for a whole year, make sure they're very comfortable. Then maybe we use a sleeve, but I know the brace is a lot of more confidence issues too, because when I've seen people with the brace on the court, and I don't know if you guys listening to this ever seen someone with a brace, they don't really move that well. They look kind of limited. I like using if the brace gives them confidence to just do some individual drills that we can do work with them, but the biggest thing is making sure they're really strong, stable, and move in the directions we want them to move, doing all these movements before they get into the court. That way their body is ready, and if they feel weird, we'll work on that specific position. But honestly, I like using a compression sleeve. It gives you some stability too, but also doesn't force you to rely on that actual DonJoy brace, because sometimes with just some light stability, it also improves your confidence. But there are some braces that help provide stability. I've used one myself, and it just doesn't allow me to move as freely. That's my point on that one, especially I think one thing is, addressing the original issues, maybe it still needs more rehab to get you more comfortable in those positions. But what do you think, Gabe?
Yeah, I think it's a complicated answer, just because we are kind of reined in by surgeons' opinions, and because they want to protect the surgical site, which is the most important thing with rehab early on. But yeah, it's we really want to make sure the person has been able to do all the movements required to return to sport, return to basketball related activities. But yeah, I'm not completely against like what Marco mentioned, even just a sleeve or a brace early on. What I tend to do, especially a very big cutting sport, we're talking a little bit about outside of basketball, but football or soccer where they're doing a lot of cutting drills. We obviously break down that task a lot without a brace in rehab setting, but when we get them on the field or on the court doing specific basketball drills, maybe that first session or two, they might not feel confident, so putting on the brace to build that mental confidence. We feel the brace or the compression is more of a helping them cross a mental barrier more than actual physical stability. When we typically clear someone to do those on-court or on-field skills training, we've done so much of that movement in rehab that we feel confident they can do it without a brace. But if maybe they just feel some type of hesitation, maybe we'll throw on the brace for a session or two and then slowly wean them off of it. We always saying if you're playing with a brace, you probably shouldn't be playing. unless something really dramatic is going on or like you really need to play. We try and really avoid that. But we do maybe like if you're doing live contact sessions in basketball where it's your first time playing 1-on-1, 3-on-3, 5-on-5 live, and you haven't done like a lot of contact yet, maybe again like a sleeve or a very light brace, not like those big chunky ones, for maybe like the first session or two until you build that confidence to get off of it. Because yeah, if you're gonna play live practices or live games, you should be in a brace. Is our thoughts. Anything else?
I think that's solid. I mean, you hit it right on the spot. It's if you're like, it's true, you don't really see that many like people in the NBA, college basketball wearing a brace. Not anymore. Before it was more common, but now more research and people are doing more rehab, on the court stuff before they actually play. So I think that's helping out with a lot of those outcomes. But following up on the ACL, we have another question here by Merrill Matthew, 3836. I'm having pain near the tibia area when they took the BTB patella graft for the ACL. How can I alleviate that pain? Because it feels like a sharp pain after playing sports or working out. What do you think, Gabe?
Yeah, I mean, that one can be a little complicated because one, we have to make sure it's where they're actually feeling. If it's coming from the patella graft itself, like could be shin splints that are referring up, it could be patellar tendinopathy. Those are different sources that would be contributing to that. But if we are saying that it's just the kind of the graft site that's giving them the issue, things that we have seen that helps with that pain in that area is like tendon health exercises like isometrics, like doing a wall sit or isometric lunge, a couple different variations that you can do, working on eccentrics with like long arc quads, negative like 2 up 1 down, single leg squats, even like decline squats with the slant board, things like that, to really break up some of that scar tissue and heal that patellar tendon that pretty much got traumatized from taking the graft from that area and got weak. So a lot of times that we've seen with our athletes that have, it's more of like a patellar tendinopathy issue that has helped, but they could also be with like patellofemoral pain where you need to work on strength in the glutes, mobility elsewhere. So there's a lot of contributing factors that can play into that sharp pain that they have. Just to answer generally, that's kind of what I feel. How about you?
Yeah, I mean, Gabe said it right on the spot. Is I think finding out exactly where their pain is. But a lot of people, I mean, we see a lot of times people do get shin splints, do get patellar tendinopathy. Patellar tendinopathy is very common, especially after a patellar graft. And I've seen it is kind of like we mentioned in our 2 questions before, is sometimes when you go back to running or jumping too fast too soon, you kind of overload that tendon, and that tendon's already at 2/3 capacity because they got a piece of the graft. So that might be causing the pain, but it's hard to say until we kind of really, but it seems like more patellar tendon or shin splints, overuse. And we have a great, I want to plug in our program, but we have a great patellar tendinopathy program, Jumper's Knee. And we actually give it to a lot of ACL people because they don't do a lot of patellar tendon work. And that's crucial as you go back to running, change of direction in basketball, because especially if you had a quad tendon or patellar tendon, just because you just take away that capacity of the tendon by using that as a graft early on.
I think that gets under rehabbed a lot just because we get so focused, or people get so focused on like developing the quads, getting your glutes strong, getting into mechanics of squatting. Sometimes the tendon, patellar tendon or quad tendon, when it gets removed, doesn't get addressed enough for that specific training. So just kind of our 2 cents with that kind of general question. So last question here, not ACL, but more related to a meniscus tear, something that we see commonly with ACL. So we figured throw it in with this. It's by M. Errol 98. Does meniscus tear pain come from wear and tear, and is it constant or does it go away with time and rest?
I mean, it's hard to say because meniscus tears, it could be chronic, or as time goes on, you have that degenerative wear and tear. That's why a lot of people, they'll get an MRI and they'll find out, oh, I had a meniscus tear, but I had no symptoms. So that's one part of it. The second part is you could have like a traumatic meniscus tear. You plant twist, you tear your meniscus, sometimes often with that ACL. But it's very dependent on everyone. Usually, like the pain with meniscus, you'll have that joint line pain right in between that knee joint. You'll also have some mechanical symptoms like clicking or locking, like the locking, your knee locks up because maybe that meniscus tear flap or that tear is inside the knee joint, doesn't allow the knee to really extend or do certain movements, so it's just kind of like, oh, you feel like you can't move. The other thing too is certain movements may cause the meniscus, pain per se, because as we go into a deeper squat or deeper knee bend, we increase the contact pressure or knee joint, and if you have a meniscus issue, that might irritate it there. But it's hard to say with the meniscus tear. Every meniscus tear is different. Sometimes, honestly, I've seen a lot of people that have a meniscus tear and they think it's a meniscus pain, but it's actually patellofemoral pain. They have pain around the kneecap, but that's another issue. It's hard to really kind of go into that with the meniscus, but normally I used to tell people if it's a meniscus traumatic tear, you'll have pain for like a week or two, then the pain will probably go away, as we rehab and everything, and it's just more finding out if you have mechanical symptoms, if you need surgery or not. Pain, what do you think, kid?
Yeah, I think what Marco mentioned was great, because there is different types of meniscus tears. One is a traumatic one. I think obviously that one can cause your pain for at least initially for the first like maybe 2 to 4 weeks. And then you have your degenerative or wear and tear meniscus issues where there wasn't a mechanism of injury, and just over time that meniscus wears down, kind of like your weekend warriors or people that are older that have played sports a lot of their life. You can kind of reproduce that pain with like when you do stress the meniscus with like end ranges of motions, like when you go in extreme extension or extreme flexion, or you have joint line tenderness kind of around like the outside parts of the tibia. But like kind of Marco mentioned, it's hard to say just because there's so many things that contribute to pain, that finding the source, the only real way to know is if you have an MRI. But with that being said, just resting, yeah, you might decrease your initial acute pain, but it doesn't fix anything. So we always preach that rest won't fix your issues. You got to actively do rehab to fix the problems. And whether it be the meniscus is a source of pain, doesn't really matter unless you're going to have surgery. You could do rehab to alleviate a lot of your pain and improve your function, essentially, is kind of our 2 cents. And that's the questions that we had for today. Hope you enjoyed and learned something valuable. If you have more questions or follow-up questions regarding these topics or anything in general, leave a comment down below or send us an email at info@thebostonballodoctors.com. We just want to answer as many questions and provide as much education as possible.
That's it. We are the Basketball Doctors. Basketball for life.